Buenos hours. This is your Monday Minutes. Today I'm going to talk a little bit about patient restraints and when we restrain patients. And I don't want to go too much into the how to restrain a patient, but I want to sort of cover some key things that you can do to sort of keep in mind when it comes time that you might need to restrain a patient. And again, I always try to mention about thinking ahead, right? Not all patients that have to get restrained are your violent psychiatric patient or someone who might be on some type of a drug, right? Sometimes patients get restrained because of other medical issues or even environmental type issues. So you have to sort of keep everything in mind when you approach these patients. You know, things like diabetic patients, excited delirium patients, right? So it's not all black and white. So keep that in mind when you comes time for you to have to restrain a patient. But also keep in mind as well that your safety, of course, is paramount, and you have to also restrain patients in a safe manner as well. And when you do this, you have to think about how you're going to document, right, on your call report when you had to restrain that patient. And documentation is important, and there's key elements I think that I'm going to go over here that you should try to remember to document. And I think if you make it a pattern of kind of covering these key elements every time it comes time for you to have to restrain a patient, you'll have good documentation. You'll cover yourself, when it comes to your patient care, and also do it in a safe manner as well. So keep these key elements in mind. So think about the reasons why that you might have to restrain a patient. And again, most of the time because the patient's trying to hurt themselves, or maybe they're trying to hurt someone else, and doesn't necessarily have to be you or your partner or a police officer. It could be threatening to hurt a family member or a child or a neighbor or whatever the case may be. And also you might have to restrain a patient if they keep trying to remove some sort of medically necessary device. You have a patient intubated, you have an IV in place that you're giving drugs through. Things like this is the type of thing you might have to restrain a patient, because if they try to remove the endotracheal tube, is going to cause more damage, and then of course going to cause airway compromise. So you might have to restrain them for something like that. So there might be some reasons why you might have to restrain a patient if they're trying to remove a medically necessary device. Try your verbal reassurance, guys. And this is something you want to document if you did try verbal reassurance, right? So in addition to documenting why you are restraining that patient, try to document that you did verbally try to reassure the patient, or you verbally tried to redirect the patient away from the combative sort of actions that they're having, redirecting them towards something that was not upsetting them. Okay, and when you talk about not upsetting them, also the environment. Okay, and when we say remove them from the stressful location, sometimes patients are agitated, sometimes they are aggressive because of the environment they're in. Maybe it's a dispute of some type, maybe there's some sort of a medical atmosphere where they feel threatened in some way, and sometimes removing them from this stressful location can help diffuse the situation and not make it required for you to restrain them. So this is why I say when you document, you're documenting things like the reasons why, whether or not you tried a verbal method, and also you want to document if you remove them from the stressful environment as well. This way, when you do have to restrain them, you've documented you tried other means, okay, to reason with the patient and to help them before actually having to restrain them. But if you do have to restrain them, keep in mind some systems you need medical control orders in order to restrain them. If you do, in your region, require you to do medical control orders, make sure you document the doctor's name, maybe doctor's med control number, whatever the case may be, whatever your protocols dictate. And when you do, doctor might give you mechanical restraint, right? It might tell you to restrain the patient's limbs. And most of the time, you're going to end up restraining all four limbs, right? Your left upper extremity, right upper extremity, left lower, and right lower extremities. And if you don't restrain all four, or whatever it is that you do restrain, document which ones you restrained. Okay, again, I'm not going over the how to do it. I'm trying to give you some key elements here on what to document and sort of the pattern that you should develop when you're thinking about how you're documenting things when you have to restrain a patient. Everything from trying to figure out the reasons why and verbal and the environment change, all the way down to when you actually have to restrain them. Okay, and at the time, I'd also give you chemical restraints. Now, some places let you do chemical restraints, others don't. It depends upon your system, right? But if you do can give chemical restraint, make sure you document the drug you use, the dosage, the time you gave it. Okay, and also you want to document the effects that the drug had or no effect that the drug had. Okay, when you do it, guys, no matter which way you do it, if you do a chemical restraint, mechanical restraint, make sure you keep doing your vital signs every 10 minutes like any other patient. But if you have them restrained, especially mechanical restraints, make sure you check the extremities. Make sure the extremities still have good neural and pulses and all that in the patient's extremities if you are using mechanical restraint for those patients. Okay, and of course the transport, guys. Don't transfer patients in the prone position if they are restrained. Transport them in the supine position or in a lateral recumbent position. Sometimes it's difficult because maybe they're handcuffed, maybe you have them some type of a secure device that you might use. Every system is a little bit different on how they go about restraining patients. But don't put them in a prone position. Get them in a lateral recumbent if you have to, if you can't get them supine because maybe they have handcuffs behind their back or something like that. Okay, guys, that's it for these Monday Minutes. Again, this is really meant today to give you some key points on where to focus on your documentation and to think about a few things you can do before you get to the actual restraint part of it. Okay, the verbal issues, trying to figure out what the threat is, why it is that they need to be restrained, okay, and thinking about even going as far as trying to get them away from the environment that they're in. That might help you to diffuse it and help you to avoid having to restrain the patient. Okay, guys, if you like these Monday Minutes, I hope you can use them. I've got a great webcast here that was recorded. I did this with Steve Whitehead from the EMT spot, and he was a guest speaker on this EMS boot camp that we did on the art of patient rapport. And this is something that can really help you when we talk about things like verbally trying to reassure, verbally trying to redirect a patient that might need to get restrained, right? And Steve really kind of discussed a lot of this and building patient rapport with your patients, getting the intelligence, the first impressions, okay, and even things on again, like diffusing a hostile scene. You can click the Join Now button here. It'll take you to a page that has a lot more information on what Steve talked about during this webcast, and also details on how you can access it and get both the video and audio versions of this training. So don't pass this up, guys. Go check it out. Click the Join Now button and get more details on that. Well, again, I hope you can use these Monday Minutes, guys. If you've got some minutes of your own, be sure to send them over to me. It's jhoff@emsseo.com. Until next week, as always, Jim Hoffman for EMS Office Hours and Monday Minutes. Stay safe.